we're going to move on to House 2224, Senate 1402, and going to welcome an act improving healthcare delivery for underserved residents of the Commonwealth.
Good morning, co-chairs Decker and Sear, and the honorable members of the Joint Committee. Thank you for the opportunity to testify today. My name is Elisa Tristan Cheever. I'm a trained physician from Brazil, a naturalized U.S. citizen, and an appointee to the Commission for Foreign Trained Medical Professionals that recommended the framework for this bill. I started medical school at age 16, graduated from FUPEC in Minas Gerais in 1989, and practiced 13 years in that country before moving to the United States. I hold a master in public health in the US from Northeastern University, and I will be a PhD by this fall. I'm fluent in English, Spanish, and Portuguese. Today, I'm the Community Navigator Manager, ICMP at Mass General Hospital. I also coordinate an educational program for international medical students and US medical providers. Over the past 15 years, I have experienced the barriers and frustration the physicians like me face in not be able to practice medicine to meet the ever-increasing demand of patients in the US. I was a visiting physician at Boston Children's in the past, but lacked financial resources and institutional affiliations needed to pursue my license in Massachusetts. To survive and raise my two kids, I worked initially as a house cleaner in a laundry and coffee shops. I'm a physician at heart. It is my dream. It was expensive, competitive, and almost impossible to find residency and redo my clinical training, even with all the experience I already have. My story is similar to other internationally trained physicians here who have years of practicing medicine and are now working as pizza deliverers, cleaners, or in sales. I belong to a network of internationally trained medical professionals that has guided many of us to explore and pursue careers in medical research, medical interpretation, and community health, so that we could at least work in the healthcare field. However, what we really want is the ability to practice here and help a Commonwealth in crisis that desperately needs a diverse, culturally competent, and flexible medical workforce. I'm strongly aware of the lack of medical care in the most vulnerable communities in rural areas of our state, often relate to simply not having enough physicians available to the number of patients that need to be served. We were fundamental to state efforts to provide public information and improve vaccination rates during the dark period of the COVID-19 pandemic. And we have so much more to contribute. We just need the opportunity to do it. For all these reasons, I respectfully urge the Joint Committee to issue a favorable report for the Physician Pathway Act.
Thank you, dear fellow. Good morning, Chair Decker, Chair Sear, and the honorable members of the Joint Committee. Thank you for the opportunity to testify today in support of S.1402 and H.2224, an act improving healthcare delivery for underserved residents of the Commonwealth, also called the Physician Pathway Act. My name is Dr. Saira. I have been a Massachusetts resident since 2009. I'm a trained primary care physician from Pakistan. I earned my medical degree at Fatma Jinnah Medical University, a prestigious medical school in Pakistan, in 2004. After graduation, I completed my clinical training, obtained my license in Pakistan, and practiced there as a primary care physician until I moved to United States with my husband and started a family here. Lacking family support, I assumed primary responsibility for my daughter, who was very young at that time, but nonetheless began preparing myself to obtain licensure here. I successfully completed all 3 steps of the United States medical licensing exam required of physicians, including the clinical skill exams, in 2009. I began applying to residency programs in Massachusetts without success because I was competing with recent medical school graduates. Throughout this time, I continued to work in healthcare field, volunteering in local free medical clinics in Massachusetts for the uninsured population and undertaking observerships to familiarize myself with the US healthcare system. I worked as a nurse's aide. In 2021, I gave up on my pursuit of a residency with a heavy heart after applying for residency positions year after year. I was disheartened, but couldn't give up my passion for medicine. So I started nursing school at UMass Boston in 2021 and graduated with bachelor's in nursing this year. And I am currently working as an RN on med-surg floor at UMass Memorial Health Marlborough Hospital. I firmly believe that I have a great deal to contribute as a primary care physician here in the Massachusetts, where the need is great. I continue to be a licensed primary care physician in Pakistan, where I return every summer, working with organizations that provide medical care to underserved populations. I would love to have an opportunity to use my medical education and skills to give back to the communities that welcomed me here 17 years ago. Thank you for giving me this opportunity to testify today.
Thank you so much. Are there questions from the committee? Appreciate your time. I want to recognize my colleague.